Today we are presenting Hospice Nursing. This presentation is by Catherine Harvey, Brittany Cook, Amy Husky, and Christy Tucker. Job responsibilities. What are the primary activities performed by this nurse, and what is the scope of practice? Education regarding the disease process, pain and symptom management, preparation for end of life, emotional support, and bereavement. According to the Hospice Palliative Nurses Association, hospice and palliative nursing practice is the provision of nursing care for the patient and family with emphasis on their physical, psychological, emotional, and spiritual needs when experiencing a life-limiting illness and through bereavement. This is accomplished in collaboration with interdisciplinary team in a setting which provides pain and symptom management, family support, and 24-hour nursing availability. What are some teaching learning strategies that can be applied to addressing specific issues related to the core population? When educating the hospice patient, education topics would include the dying process, nutritional support, how to communicate about sensitive issues such as a POA, a DNR, or a living will, what services are offered through the hospice care, whether it be equipment, when the nurses can come, how often they can come, and when to call them. Who would the teaching be focused on? The teaching in the hospice nursing would be focused on both the patient and the patient's family or support system. Some special considerations to take when providing education and teaching. Although providing comfort transcends cultural values, nurses should incorporate an understanding of unique cultural values, expectations, and preferences into hospice and palliative care. It is of utmost importance for the hospice nurse to be mindful of the cultural beliefs and preferences when providing education and teaching end-of-life care. When dealing with a child in hospice care, it is important for the hospice nurse to be mindful of the child's cognitive, psychological, and spiritual development. That will help the nurse's ability to provide advocacy for the patient, whether it be with teaching, pain, or communication.
So education required for the hospice nurse. Education requirements would be either an associate's degree or a bachelor's degree, which most companies prefer the bachelor's. Master's level education is also available for the hospice nurse. All hospice nurses must have an RN license, and some companies may even require you to have special certifications in hospice and palliative care. Some different certifications that are currently offered are Advanced Certified Hospice and Palliative Care. There's also a certification in perinatal hospice care and pediatric hospice care. Hospice nurses collaborate with different professionals on a day-to-day basis. From when they go in the hospital to meet with the patient for the first time, they deal with the nurses and physicians and home health and the CNAs in the hospital that are dealing with the patient on a day-to-day basis to learn about the patient. They also interact with the social workers, chaplains, and volunteers. And then once the patient is admitted to hospice, bereavement counselors, chaplains as well, and home health aides that are going to the patient's home to help care for the patient.
Skills required to be a great hospice nurse. 1. Communication skills. Communication is one of the most important aspects of a nurse's job. Listening to patients and patients' families' concerns and fears are a huge part of hospice nursing. 2. Emotional stability. Hospice nursing is a stressful job where traumatic situations are common. The ability to accept suffering and death without letting it get personal is crucial. A hospice nurse must know how to manage stress of a sad situation. 3. Empathy. Great nurses have empathy for pain and suffering. They are able to feel compassion and provide comfort. 4. A calming presence. With terminal illness comes anxiety, fears, and difficult emotions, both for the patients and the patient's loved ones. 5. Physical endurance. Not only does a hospice nurse experience mental fatigue, they also frequently physical tasks standing for long periods of time, lifting heavy objects or people, and performing a number of taxing maneuvers on a daily basis. 6, respect. Respect goes a long way. Great nurses respect people and rules. They remain impartial at times and are mindful of confidentiality requirements and different cultures and traditions. Above all, they respect the wishes of the patients. 7, pain control expertise. Patients nearing the end of life unfortunately can suffer from a great deal of pain. Hospice nurses know exactly what to do for patients who are hurting, and they are able to teach the families to do so also.
Why are hospice nurses unique? Well, hospice nurses actually can serve anyone with life-limiting illnesses regardless of the patient's age or their type of illness. Research has shown that the majority of Americans would prefer to be at home at the end of life. Hospice nurses make that possible for most people. Hospice patients and families can receive care for 6 months or longer. Following the death of a patient, bereavement support is also available. Fear of cost should never prevent a person from receiving hospice care. Medicare, Medicaid, and most insurance plans will actually pay for hospice. Research has shown that people receiving hospice can live longer than similar patients who do not opt for hospice. And lastly, hospice nurses provide on-call nursing 24 hours a day, 7 days a week to monitor changes in the patient's condition and attend to their every need. That concludes our presentation on community health hospice nursing.